he's going to be all floppy.
Why is he floppy?
So he's got like just extreme hypotonia. So he like has very low muscle tone. So he's 3.5, but he can't stand, he can't sit on his own, he can't fully hold up his head. And that's just really typical of his disease.
Before we talk more about his disease and how it impacts him, what do you want the world to know about DJ? What's the most important thing?
That he is more than his disease. He, like, though it may be very subtle, like, has likes and dislikes, that he has emotions, strong emotions actually, and that he's valuable, you know, he is worthy of things just as any able-bodied person is. And me being pregnant makes me very emotional.
Welcome to SBSK. We believe that everybody has a story that's worthy of being heard. When we listen to one another, the world becomes a closer place, and we all benefit together. So without hesitation, let's meet today's friend.
What is your role within DJ's life?
So I am his primary caregiver. I used to work, and then when one of the several times he almost died, was like, I can't take this and I need to be there for him. So yeah, it's a lot. He needs constant help. So lifting his head, holding him up, sitting him up, making sure he's, not just laying in one spot for too long. So it's just constantly moving him around and making sure that he's a happy boy. When
I came into your home, he was laughing at a Miss Rachel clip on the TV.
Yes.
Tell me about some of his likes.
Miss Rachel are his likes. For the most part, you can't just like sit him in a pack and play with a bunch of toys and he can entertain himself. Like, he can't sit up, he can't reach for things and like pull them to his mouth in a seated position. So he relies a lot on that input coming from like a television or a device or like external sources, giving it to him rather than him like giving it himself.
We tried so hard to not have like an iPad kid, but with him being nonverbal and being how he is, we quickly realized that was not going to be a thing. And
right now he's communicating to you something, right?
Yeah, he doesn't like what's on the TV. So we're going to change it. This is also my life, being a human remote control for him, and making sure that whatever's on, he's okay with. So it's a constant thing. I know.
But when he's unable to move around independently, that's a big part of his world, right? What's on TV?
It is. It's a huge part. I try to get him into a lot of cool things that I watched when I was a kid, like Fraggle Rock and stuff like that, but he's Miss Rachel or Hey Bear all the way. Nothing else. Tried Bluey for a little bit, and he'll tolerate it for, sometimes a minute, sometimes 10 minutes, but then it's right back to Miss Rachel.
For his whole life, he's relied a lot on, that visual stimuli in the form of YouTube videos like Miss Rachel or Hey Bear. Those are like the two big ones, and like the main purpose of those in the beginning was just to like give him some really good distraction in the hospital when like scary things were happening, like he was undergoing procedures or like they were changing his dressing on his skin and it hurt, or they were putting an IV in, and like he's been through so much. So like all of the stigmas about like screen time for kids kind of just went out the window for us. Like those same rules don't really apply here. So like he got very used from like being a little baby to like relying on those things for comfort. But there are certain like skits that he rotates through that he just like loves and will make him laugh out loud. And then he whines as soon as they're over, and you have to rewind them and play them over and over again, which I think is actually very typically toddler of him.
He's a smart boy. He really is. you know, and it's neat when you have a kid like DJ who's nonverbal and can't talk, when you realize that he is picking up on things, like when they experience like anticipation. So for instance, he'll have a favorite part on Miss Rachel that'll come up and he knows it's coming up. It's neat to see like them kind of figure that out.
How does he show that anticipation?
He starts getting excited. Like he'll start pushing against you or against whatever he has. He'll kind of kick and point his feet a little bit, or he'll start to smile, or like this part coming up he doesn't like. So kind of before it comes up, he'll start to complain.
So he has his own form of communication.
Yes, he will whine at you if he wants you something like fast forwarded, or he's just not into what you have on. He will whine about it. And then when he loves it, he laughs. And if he's just fine with it, people have said to me, they're like, is he okay? Like, is he doing all right? And my rule of thumb is like, if he's quiet, he's fine. Because like he will let you know if he's not okay.
Walk me through his diagnosis process. What were the first signs that something was happening?
So there were no signs, actually. There's a couple different forms of Krabbe disease. There's early infantile onset, which is what he has, which is the most extreme, form. Early infantile, they usually start showing, symptoms outwardly anywhere between, 1 and 4 months, I think. And then without treatment, it's fatal always by 2 years old. So he doesn't like what we're watching right now. So let me fast forward it.
So with him being nonverbal, it's just learning him and his needs and how he acts and reacts to things and his mannerisms. You get really good at, figuring out what they need when they can't talk. So, yeah.
What have you learned? Little mannerisms that let you know what he needs and wants?
So, obviously, when he's not happy, he cries, but he has different cries. When he's sick, he has different cries. When he's upset, he has different cries. When he's happy, he has different sounds. When he's scared, when he throws his little hands up and he's not happy.
Like he did just there?
Yeah. Again, he's just not happy with what's on the TV. So fast forward it again.
How much of your day is spent managing what he wants on TV?
All day. From the time we get up to the time we go to bed. We are about this far apart almost the entire day. I might go to the kitchen or, take out the trash, but he's either sitting in his chair or he's on the couch like this with me.
How much does your world change when you have a child with DJ's level of disability?
It basically flipped itself on its head. Just even for me and my wife to just go out to dinner, no one has ever really watched him. I think her sister watched him twice just because he's so fragile. And with him, he can choke a lot. He has a lot of problems swallowing. So it's a constant look out for him silently aspirating and choking. So a lot of people don't feel comfortable with that. And to be able to watch him, and so it's just us all the time. And if we want to go out to dinner, then he'll come. He comes with.
I know. Early infantile onset without treatment is always fatal by 2 years old. I can feel when he's about to. I feel his body clench up. I think this is just going to be the rest of the time here. Sorry, let me just get a tissue. He's going to flop over. I know, bub. And I think this is very true with a lot of diseases. Which is unfortunate, but a lot of the outcomes depend on your zip code. and where you live. So like Krabbe disease, so I don't know if you know about like newborn screening, but like, you know, kids are flagged for different diseases via newborn screening from like a heel prick when they're born, and that blood gets sent to the state, and then they get flagged if certain things, you know, are markers for stuff. At 6 days old, he was flagged. There's only like, I want to say now 12 or 13 states in the US that flag for Krabbe, because the thing about Krabbe is if you do not treat for it within the first, like, ideally 30 days of life, their prognosis is bad. If treatment's unsuccessful or if they don't get treatment, then they definitely will not live past 2 years old with early infantile onset. Like on his first to second week of life, we went to CHOP, they did spinal taps, MRIs, blood work, the whole workup. He was there for 4 days, 4 nights. And then he officially got the diagnosis at 16 days old. And at that point, there were no like outward things that we could see, you know, only test results. But like to me, he was like a typical baby. And maybe he did have a couple slight outward signs that like, because I was a first time mother, I had nothing to compare it to. So like to me, he was like perfect, you know.
And how long have you been his full-time caregiver for?
Technically since the day he was born, but he spent 11 months in the hospital. At 6 months in is when I quit my job to start taking care of him. I spent every night with him in the hospital. Between me and mom took days, mornings and days for a while, and then I took nights, and we just kind of rotated like that. Outside of being in the ICU, I can count on one hand how many times he slept in the crib. He slept hooked up to every cable you can imagine. He still slept on me, and I slept in a little chair. Every night, he slept on me.
So the treatment is cord blood transplant. So they take healthy cells from a donor cord blood. They do chemotherapy to wipe out their system, and then they transfer the healthy cells, and then the goal is that those healthy cells will start to replicate themselves and the body will accept it. And then what that will do is balance out the enzymes that are out of whack because of Krabbe disease. So like with Krabbe disease, what you have in your body is something called psychosine, which is a type of enzyme which when it's too elevated is toxic, and it eats away at the like neural sheaths that cover your nerves, which like send signals throughout the body, and like over time that's deadly. And that's another reason why kids with Krabbe like have trouble, you know, they have muscle loss, they have trouble swallowing, all those things that require like your brain to talk to your body.
Like he needs everything from us, you know, moving his head, twisting his body, sitting him up. Like he requires everything from us. And
I wish we were
done
10
a pretty
years.
good job.
I wish we were 10 years younger. It's hard.
It's hard.
You feel your age. You do.
Absolutely. Like I've had 4 back surgeries, so I'm in constant chronic pain every day. So having to bend down and carry him and lift him, it's only going to get tougher. You know, the heavier he gets, the older he gets. With
cord blood transplant, it's not a cure, but it just slows the progression. So doctors are hopeful that he will live like kids with transplant can live like into their early 20s, but with like severe disabilities. Some parents choose not to do transplant because it is in and of itself very risky. Some children don't survive it. And if you choose not to do treatment, like that is a valid choice. I actually almost decided not to. But Dave, so we went through IVF to have him. And, you know, 3 years of infertility with treatments. And Dave was just like, you know, we went through a lot to have him. Like, let's do everything we can to keep him here for as long as we can. So I was just like, okay. In his case, his first transplant was unsuccessful. So like he didn't engraft, which is what they call it. His body rejected those cells. On the day of his second transplant, he had a hydrocephalus event. So he had just like random fluid build up. So we had to have an emergency drainage placed. And that delayed. So, but then he was able to get his transplant this next day. And then he had to have a permanent, a couple weeks later, he had a permanent shunt placed in his head. And that is there forever. And that just like drains excess fluid. He's had it clog a couple times. So since then, we've had to have it revised a couple times. So that's surgery.
What is it like to know everything DJ's been through and hold him today?
Sometimes I don't. It's funny because sometimes I don't even think about it. You know, we're just kind of like living in the now, in the present. Every once in a while, I'll sit at night. Usually, when I'm kind of by myself at night, is when I'll think back to what we had to go through. And it's one of those things where it seems like it was just yesterday, but also like 10 years ago, even though he's only 3.5. You learn a lot about yourself, your partner, what you can accomplish and push through. You know, there were so many times where she's like, I can't do this. I don't know if I can do this. And it's like, you can, and you will. Like, we'll get through it. We'll get through it together.
That's what he said to me the first, when DJ was going into surgery. Shortly after we arrived at Pittsburgh, he went into surgery for them to place the central line in his chest. And we were sitting in the cafeteria at the hospital, like, getting food, and I was, like, panicked thinking about, like, I have to sleep in a hospital room with my sick newborn for God knows how long. I was like, I'm like seconds away from a panic attack. And he was like, you can do this and you have to do this. And I was just like, okay. But yeah. I think also to answer your question too, like it makes you more, I have a lot of moments where like he's sleeping on me like at night, before he goes to bed, where I'm just like, I try to be like really grateful in that moment, like grateful that we got here, but also like grateful and trying to like remember as much as I can now, because like in 10, 15 years, like we're gonna want to remember this moment with him, you know, and like smelling him and touching him, and you know, I try to, the biggest thing that I always tell people is like this whole experience shifts your perspective of like what matters.
It's different for sure, but I don't know anything else really. Like this is what I know. So for me, it is what it is, I guess. You know. I'm so sorry. Do you want to sit up?
Do you ever look at his whining, if you would call it that, as a form of communication and think about being grateful that he can do it?
Very much, yes. I mean, the fact that he's here, that's all that I wanted. Like, there were a couple times where we could have lost him. You know, it's difficult when you're in the hospital and they're hooked up to all these machines and they don't know what they don't know what you're saying, but you're having these conversations where it's like, you're tough, you can do it, and they're just kind of looking at you. That's kind of difficult, but thank God he's stubborn, because he fought hard. He fought very hard.
Some of the other like things that some kids with Krabbe disease go through are, not everyone, but it's supposed to, which is why he's going to be closely monitored. It's supposed to affect their vision over time, their hearing. His is still wonderfully, like, too good sometimes. He can hear a pin drop. I think the thing that took me a while to get over the most was the inability to eat by mouth. Because, like, I'm such a foodie, and, like, it really hurt my soul that, like, oh, he'll never be able to like eat this delicious bowl of ice cream. And like, so he eats, like he threw that. He's got a G tube. He had that placed when he was 4 months old in the hospital because he started to like choke a little on his medication. So they were like, look, we should place this now before things get worse. So I was like, fine, let's just do it. And I like pumped. I was still trying so hard to breastfeed him because like I had it in my head that like, this is going to make me cry. Going through like postpartum and all of this was really hard, but I had it in my head that like, well, maybe like I could give him breast milk and like that could heal him, which was like the stupidest thing to think, like, but I like still tried so hard, like, cause I like felt like, okay, well, it's one of the only things I have control over is like feeding him from my body.
I definitely processed it in my own way. When you know, like when you have a son, you kind of have that, like, oh, we're gonna play catch and we're gonna go fishing and we're gonna do all this stuff, you know, dad and son bonding. And obviously I can still bond with him, but it's very different. So for me, I processed that pretty quickly and was like, all right, well, that's not gonna happen. I mean, it can, like, there's a lot of things, like we went swimming yesterday, so there's a lot of things that I can still do with him, but it's not the same.
How does he go swimming?
I carry him, and I hold his little head and he floats. He actually floats pretty well.
So with I think almost any other genetic condition, when you have children and you're both carriers, you have a 25% chance that your child will not have it. You have a 25% chance that they will have it, and then you have a 50% chance that that child will be a carrier for it. So I was a carrier, my husband was a carrier, but it's so rare. So then we did, when he was getting his genetic testing, when we were testing the embryos, we also did extended carrier testing to see if there were any other diseases out there. And there's nothing else out there that we're both carriers for. So.
What was it like getting pregnant again?
So like I said, we have embryos, frozen embryos, so we did another embryo transfer of a non-affected embryo. I made the embryologist check like 5 times and show me physically on a piece of paper like that it's the exact one that we were looking at. I'm still scared. Like I still have doubt and I'm still terrified. But so far everything looks fine. But it took a long time, maybe a few therapist appointments and just a lot of conversation for us to take that leap. I don't think you ever like are like, yep, I'm ready. Like you just, it comes down to just like, I'm okay moving forward through fear. Also because like we're old, like he's like, Dave's 44, I'm 38. Like I just didn't want to keep waiting because you never know what can happen too. Like if this transfer of this embryo wasn't successful or if I had a miscarriage or something, like it would take that much longer and I would be getting that much older.
She's pregnant and we're expecting a little sister for him. So that's going to be fun. I think that's going to be something to get used to, is having, like when I put him down, he doesn't move. Like I could, go to the moon and come back and he'll be in the same place. So having something to chase after is going to be, for us, that's going to be abnormal. So it's going to be a learning curve for us for sure.
We don't know how long we have with him. And while like child number 2 is certainly like would never be a replacement, like I don't want anyone to ever think that. And it's not like that at all. At the end of the day, like I don't want to be old and die without any children. Like I know that I'm going to outlive him. It was just like grief that never stops. It's like normally you don't know that, anything can happen, anything's a possibility, but like when you have a kid with a fatal disease, it's 100% you're gonna outlive them. And yeah, that's just like day-to-day grief that you live with forever.
Has being a full-time caregiver impacted your mental health at all?
My wife says sometimes she thinks, but for me, I don't mind. Like this is my baby boy. You know what I mean? So I will do absolutely anything I need to for him. So, you know, did things change? Yes. But for me, it's normal. It's normal. You know, getting him ready and up in the morning, making his meds multiple times a day, feeding him through his tube, burping him, bringing him to his doctors, his physical therapy appointments. It's just normal. It's what we do.
Is there anything left unsaid that you think is important for people to know?
There's so many things. Get expanded genetic testing done if you're thinking about having children, because you never know. I never thought something like this would happen to me, and it can happen to anybody. Try to be grateful for the good in your life. Try not to judge what others are going through or how they got there. And, you know, just approach everybody with kindness, because you just don't know.
Is there anything you would like to add to that?
Pretty much the same thing. I would say, like, patience. Also, don't treat anybody differently. Like, he's a precious little boy, and you know, a lot of he just like anyone else to a degree, and you know, he's smart, and even though he can't talk, I would say,
That's very close to what I said in the beginning. That, like, he is so much more than his disease, and I think we tend to, like, label people with disabilities and differences and, like, view them in a different way, but it's really opened my eyes to the fact that he has just as many, like, emotions and feelings as anybody else, even if he can't fully, like, express them in the typical way.
Thanks for watching SBSK. Click subscribe here to be part of our community. Then hit the notification bell below so you never miss a story. You can even meet another friend here. See you next time.